Can BCG vaccination cause a false positive TST result? Imagine getting a skin test for tuberculosis and seeing a positive reaction, but you're not sure if it means you actually have the disease or if something else caused the reaction. This is a common question for many people who have received the BCG vaccine. The BCG vaccine, which is used in many countries to protect against tuberculosis, can indeed cause a false positive result on the tuberculin skin test. The reason is that the skin test detects immune responses to a substance called purified protein derivative, or PPD, which is derived from the bacteria that cause tuberculosis. But BCG vaccination uses a related strain of mycobacteria, which can sensitize the immune system and lead to a skin reaction even if a person has never been infected with tuberculosis. So, if you've been vaccinated with BCG, a positive TST might not necessarily mean you have a current or past infection. It could just be your immune system reacting to the vaccine. The timing of the BCG vaccination plays a role in how it affects the test. If BCG is given in infancy, its impact on the TST is usually minimal after 10 or more years. But if BCG is given later in life, especially after infancy, it can cause larger, more persistent positive reactions on the skin test. Some countries give multiple doses of BCG, which can make the skin test more likely to stay positive for longer periods. Also, repeated skin tests can boost the immune response, making reactions more noticeable over time. Because of these factors, it is difficult to tell whether a positive TST in someone vaccinated with BCG is due to actual tuberculosis infection or just the vaccine. The size of the skin induration, or swelling, overlaps between true infection and vaccine effects, so doctors can't rely on the size alone to make a diagnosis. To improve accuracy, health professionals often prefer blood tests called interferon gamma releases assays, or IGRAs. These tests are not affected by BCG vaccination and are more specific for detecting true tuberculosis infection. They are especially useful in people who have been vaccinated with BCG or exposed to non-tuberculous mycobacteria, which can also cause false positive skin tests. In practical terms, if you have a history of BCG vaccination and a positive TST, your healthcare provider will consider your risk factors, exposure history, and possibly recommend further testing with IGRAs. This helps ensure you get an accurate diagnosis and appropriate treatment if needed. Remember, always consult a healthcare professional for personalized advice, as interpreting these tests can be complex and depends on individual circumstances.